Sound check 1 2 3. Sound check 1 2 3.
Good morning. Good morning. Welcome to the Public Health Committee meeting. I would like to call the meeting to order. Today is August the 14th, 2024. Joining me in council chambers this morning is Councillor Tom Jackson, Councillor Tammy Wang, Councillor Mark Tattison, Councillor John Paul Danko, Councillor Beattie, Councillor Kazar, Councillor Crutch, Councillor Clark, Councillor Alex Wilson. On screen live and freshly shaven is Councillor Matt Francis. Good morning. Elsie Gauthier, are there any changes to today's agenda?
Chair Wilson, there are no changes to the agenda.
Wonderful. Moved by Councillor Kazar, seconded by Councillor Beattie to approve the agenda as presented. Thumbs up from Councillor Tattison. Thumbs up from Councillor Jackson. Councillor Crutch is voting in the affirmative, as is Councillor Danko. Thank you. That carries 11-0. Any declarations of interest this morning? Seeing none. Approval of the minutes of July the 10th. A mover and a seconder. Councillor Alex Wilson, Councillor Brad Clark, please. Any discussion on the minutes? Seeing none. Councillor Tattison voting in the affirmative. Thank you. Councillor Danko's voting in the affirmative. I told him to. Thank you. Thank you. That carries 11-0. Thank you. On the communications, 5.1, correspondence from Middlesex London Health Unit respecting support for bills S233 and C223, an act to develop a national framework for guaranteed livable basic income. A mover and a seconder to put it on the floor. Councillor Jackson, Councillor Wang. Any discussion? Recognizing Councillor Wang, followed by Councillor Alex Wilson. Thank you.
Through you, Chair, just wanted to understand, if we put it on the emergency and community services, does this require additional instruction other than it going on to emergency and community services? Like, is that the right time to speak about that here? Or is that once we put it on ECS and that's where it goes?
Yes, thank you. That's a really good question. This is always a dilemma as your vice chair on matters related to income, which, as the correspondence notes, is absolutely health policy. But procedurally and from a governance perspective, it was determined that it should be referred to ECS, where matters pertaining to income are normally deliberated. But if Elsie Gauthier would like to speak to your question and give an answer, thank you.
Through the chair. So it was given this recommendation so that Public Health Committee could discuss at this meeting the merits as it relates to public health, but the matter is related to income really belongs to emergency and community services. So that's why that recommendation came about, so that you could discuss the public health merits here, but it really belongs at emergency and community services. Does that answer your question?
Yes, I just wonder, through you, Chair, to Elsie Gauthier, should we add additional instructions? So beyond it being discussed at, say, ECS, could we also ask for a report back or an opportunity for public discussion, any type of delegations that might come forward on seeing that this correspondence go on to ECS? Essentially, I would like to see this be a bigger and larger topic beyond just a correspondence item that goes on to ECS. That's what I'm asking. Should we provide that level of detail in terms of instructions, or is that we have to wait until ECS? Because the minute it gets put onto ECS, it's put on as a correspondence item, then that's the time that we can provide just direction. But if, let's say, we wanted to have a more fulsome discussion, that's a further next conversation at ECS. So we're looking at two to later ECS before we actually have this conversation. So I'm just questioning what the procedure or the directions look like.
I'll let Elsie Gauthier comment on that, but it is the prerogative of every member around this horseshoe to speak to, in whatever depth that they would like, the correspondence, in this case, as it pertains to public health, and any further direction in relation to public health. When we get to ECS, you can provide, you have to wait a little bit, of course, as much fulsome direction and commentary as you wish, as is your prerogative as a member.
Then, Chair, I feel that my question has been answered. Thank you.
You're welcome. Councillor Alex Wilson.
Same question, but different, I think, piece actually. Instead of ECS versus here, just I think maybe just saying this out loud as a council, I think it's a provincial versus a municipal or a federal in this case. It's at the Senate. And so I think that's more the piece for me is if we would like to also write a letter to the Senate saying, let's do this, maybe not as a Board of Health, but as a council, we can get it there. If we'd like to have a discussion at ECS about our GR strategy, great, let's bring in staff. But I think it's more what is the outcome we as a council want to take on this federal matter. There's something currently before the Senate. A public health committee has passed on correspondence to that committee saying, we think this would be a good idea for public health reasons. Regardless of the reasons, I think it's just what do we want to do on this? And so happy with this direction as it is, but just putting that out there as well, that we have a council meeting coming up, folks can move motions. Like if we want to participate in this very discrete activity, providing correspondence to a Senate committee, we can make that happen. If we want to have a conversation about GR, we can make that happen as well. Happy with the direction as is, just wanted to put that out there.
Thank you. Any further speakers? If I can ask Councillor Kassar just to take the chair for a moment.
Go ahead.
Just a brief question. I don't recall, but through the chair to staff, do we know the timeline for the consideration of these bills in their fullness? Through the chair.
Through the chair. Through the chair to the councillor, Brendan Liu, Associate Medical Officer of Health. I don't believe that we have that information at our fingertips, but we can certainly follow up.
Okay, thank you. I think knowing that will inform perhaps the window further to Councillor Alex Wilson's request and comment of if we would like to get this to the Senate, we need to get it in advance, obviously, of royal assent. So I'm wondering if we could inform the action such that we could ask staff to use their discretion. So if the next ECS meeting is going to be past the point of no return, how could we procedurally advance this so that we don't miss that window? I'm wondering if I could ask the clerk that.
Through the chair, so the next Emergency and Community Services meeting won't be until, I believe it's September 19th. So if you wanted to make sure that action could be taken on it in case it makes its way through the Senate past then you could refer it to council.
Okay.
Rather than Emergency and Community Services.
Thank you for that suggestion. I really appreciate that. I see some other hands going up, so I'm sure we can bring some conclusive action to this. My only other comment, of course, is the continuous discussion about the importance of income. I know my colleague, Councillor McMeekin, has been a long-standing advocate of daylighting the importance of this. We know that income is housing policy. Income is education policy, income is food security policy, but in particular to Hamilton, we know that the concentration of urban poverty in Hamilton is amongst the highest in Canada. I'm reading from a public health report here. Those living in Hamilton's most materially deprived areas are 3 times more likely to die prematurely from potentially avoidable causes of death. 81,000 Hamiltonians live in low-income households. 44% of single parents with children live in low-income households, which is greater than the Ontario average. Hamilton, the Indigenous communities in Hamilton face, of course, severe health and social inequities. 78% live in poverty. They experience higher rates of infectious and chronic disease and substance challenges compared to those who are not Indigenous. We cannot afford to fall behind as a modern nation in our responsibilities to the most vulnerable. The most basic provision of food security, of housing, of good quality, accessible public education is paramount to our economy and to our standing as an industrial modern nation. The fact that we have too many Canadians and Hamiltonians not only living below the poverty line, but living severely below the poverty line it should be unacceptable to all of us. And I don't care whether you're moved by moral obligations or a sense of this is not in the interest of our economy, whatever moves you, this cannot be acceptable. It is not sustainable as a nation and as a province to be in this predicament. So I'll leave the comment at that, and I'll take back the chair. Thank you very much. I thought I saw, Elsie Gauthier.
Through the chair, just wanted to add that looking at the Senate calendar, their first sitting is September 17th. So I would expect there'd be no progress on the bill until at least that date.
Oh, good to be a senator. Okay, so we have some time. I will recognize Councillor McMeekin. Did you wish to speak to this matter?
I sure do. In fact, I was debating this morning whether to turn over and sleep for another hour or come, and this was what I came for. So I appreciate that, and I'm particularly appreciative of your comments, Chair, just now. There are many experts out there who will reliably articulate that next to birth weight, the single most important determinant of health is income. And I heard a fellow on CNN a couple of weeks ago who's an expert on longevity. He's from Sweden, and he wrote a book about how everybody can live to be 90, and he predicts that 50% of those children born today will, provided they have enough income, will live to be 90. Yeah, you know, with the experiment we did here in Hamilton, the pilot project, which I played some small role in, as you may recall, there was ample evidence that providing that $2,000 a month was indeed a fundamental key component of some transformational health locally. So whether it belongs in this committee or another committee that maybe has a financial magic wand that they can wave, really doesn't matter. What matters, particularly when you outline the the stats, 41% of the people that live under the poverty line in Hamilton are children. You know, that really hurts when we're at a city who one of our key mission statements is to be the best place to raise a child. You know, and someone said to me not that long ago, how would you prevent child poverty? My response was, don't allow any child to be born into poverty. And there are countries all around the globe that have taken that to heart and have provided that. And guess what? The health outcomes are better. The happiness outcomes are better. There's Wayne Easter, the Honorable Wayne Easter, who's now retired, said, contrary to what some of the skeptics, mostly right-wing, more philosophically conservative people were suggesting, that it would be fiscally irresponsible. He was able to point to the benefits of that 14% on the lowest income threshold and the benefits from an education, debt reduction, health perspective. So this basic income stuff is absolutely probably the best single investment we as Canadians can make, and we as a council should support. I mean, we're good at declaring a crisis on everything: mental health, family violence, hunger, hate, homelessness. Just imagine what would happen to some of our on-house folk if they had $2,000 basic minimum income every month. Anyhow, that's what I wanted to say. And so, you know, and by the way, we were unanimous when we endorsed basic income. So when a sister municipality comes along and says we support our motion, I would hesitate about 3 seconds before I decided that would be the appropriate thing to do. Anyhow, here ends the sermon. Sorry.
Thank you, Councillor. It's not on the speakers list. Councillor Clark, would you care to speak to this?
Thank you very much, Chair Wilson. I appreciate the opportunity. This council has continually supported and endorsed basic income. It's important that we remember and recognize that some of the most challenging economic issues for this council and this city are related to income. If you look at senior citizens who have now retired, 40% of them did not have a pension. So they're getting CPP and old age security and whatever they were able to scrape together to save for their retirement. That's not much to survive on when you consider many of the drugs for healthcare are not paid for by the Ministry of Health. I have had residents in my community who had cancer and they mortgaged their house to pay for the drugs that the government of Ontario would not pay for. But if they were in the hospital, they would get it in an infusion and not pay for it. So there's a real problem there, and we have many people who are struggling to make ends meet while just simply surviving. Not thriving, just surviving. I don't think public health should wait. I think we should make the recommendation to council, and then council, the mayor, can send a letter of endorsement appropriately. I think it's important that large urban municipalities participate in this process because many of the people who are living on the streets today had homes 6 months ago, a year ago, year and a half, 2 years. They lost it because they didn't have enough income to pay the exorbitant rents that went up. They lost it because they lost their jobs. So all of these things are all related back to what's my income? And if I have insufficient income for myself and my family, then I have to make some crucial decisions. I talked to a mother 2 weeks ago who had to decide, well, I'm not feeding myself as much as I'm feeding my children because I don't have enough money in my budget. So imagine a mother starving herself to pay for food for her kids to make sure that they were fed. That's what some of the things that people are wrestling with. And I've got seniors who are eating a sparse diet because they cannot afford taxes, they cannot afford gas, they cannot afford basic living costs. It's important that the feds understand what people are truly experiencing, and we are the closest governors to the ground. We know what residents are experiencing, and we need to share that plight with the federal government. I would urge that we adopt a resolution today and have council adopt it at the next council meeting, and let's try to expedite some of these decisions. Thank you, Chair, for the opportunity.
Thank you. We have some proposed action on the table, but I'll first recognize Councillor Cassar.
Yeah, thank you, Chair. And I fully support what Councillor Clark has just said. I won't repeat it, but fully agree. And just want to recognize that maybe not everyone around the horseshoe is in the same place around thinking of basic income. I'm not going to make any assumptions, but in case we're not, I'll remind members that earlier this term, we all received a book called The Case for Basic Income that was delivered to us, I believe, by the authors, and that contained a whole lot of content about that pilot right here in Hamilton. So I would just suggest and remind members that if you have that and have not read it, I would highly encourage you to do that. It gives some great insight supporting the comments that Councillor Clark and others have made. And if you're interested and don't have your copy, I'd be happy to lend you mine. Thank you.
Thank you. So I believe we have some proposed direction on the table. I don't see any further speakers. That we refer this letter along with our endorsement as a Public Health Committee to Council for its ratification of that action. Is that, do I have that in order? Okay. And it's moved by Councillor Clark, seconded by Councillor Alex Wilson. Thumbs up from Councillor Jackson and McMeekin. Morning.
So we'll just be approving the communication as amended.
Okay. Alex Wilson, but doesn't, yeah. I think if it's okay, I think Councillor Alex Wilson would like Councillor McMeekin to be the seconder, given his pioneering advocacy on this matter. Thank you.
Thank you.
Oh, there's Councillor Jackson. Thank you. That carries 13-0. Do we have to now vote on the communication as amended, or that's all wrapped up in a nice, neat package? Thank you. Would like to recognize that Councillor Esther Pauls has joined us. I just didn't want to disrupt the flow of things. Thank you. We're on now to consent items. 9.1, third-party air monitoring at Green for Life, Stony Creek Regional Facility. The report number is BOH 24008A in Ward 7. A mover and seconder to put it on the floor, moved by Councillor Taddison, seconded by Councillor Clark. Any discussion? Councillor Clark.
Yes, thank you, Chair. Can I ask first if we have a representative of the third, I can't find Realis, Atkins Realis, are they present?
Director McDonald, please, could you help?
Thank you, Chair Wilson. Through you to Councillor Clark. Thank you very much for the question, Councillor. Yes, Darren Dixon with Atkins Realis is joining us virtually this morning to answer any questions.
Invite isn't working right now.
Super. If I may.
One moment, please. I'm seeing a problem with.
Oh,
No,
Sorry,
he's not, actually.
Councillor, we're learning in real time right now that there is a difficulty with the invite that has been sent to Darren Dixon, engineer from Atkins Realis, to attend the meeting.
That's fine.
I believe that I could navigate and respond to any questions, but if there are questions related to the technical effort, happy to take them and report back.
It would be fair to me to say that while I tend to like to ask the questions of the source, the people who actually did the work, our staff work directly with Atkins Realis throughout this process and with my office, so they're more than capable of also answering the questions in the stead of Atkins Realis. So if I can ask, Chair, that we look at the report, the main report, not the Atkins Realis report. Sorry.
Excuse me, I'll look to Elsie Gauthier, pardon me, Councillor Clark, just to pause. I see a figure on the screen and can you hear me, the individual on the screen?
Yeah,
Could you kindly identify yourself?
sorry, it's Darren Dixon from Atkins Realis.
Okay, thank you. I just wanted to confirm. We have Councillor Clark, who has the floor, and I believe he's may have some questions for you, but we'll hold off. Councillor Clark.
Thank you very much. So I'm looking at the information report, just for everyone's clarity at the moment, which is 9.1, and I am looking at page 3 of 6. So in the second to last paragraph, it says the detectable volatile organic compounds species were as follows: acetone, benzene, chloromethane, dichlorofluoromethane, methyl ethyl ketone, propylene, toluene, trichlorofluoromethane, and xylene. Boy, I'm glad I took that chemistry class just so I can pronounce those words. So during the sampling protocol, those were the identifiable species that we wanted to test for. Can I get confirmation from staff or Mr. Dixon?
Through the chair to the councillor, those are also known as a category of chemical called a volatile organic compound. So when testing for VOCs, or volatile organic compounds, those are the chemicals that are the sub-nature of the category of volatile organic compounds. And those chemicals would have been assessed for in the sampling.
Thank you for that. And again, I think from a protocol standpoint, Chair, I'll leave it to staff as to whether or not Mr. Dixon will answer, or staff. That way I don't have to direct it to any one individual. To a resident who is reading this report, missing from that is hydrogen sulfide, which was the odor that people were smelling. So can someone address how we tested for that when it's not listed here as a part of the volatile organic compounds? And I'm not judging anyone, I'm simply asking for clarification, because residents will look at this and say, wait a minute, we didn't ask to sample that. We were looking at hydrogen sulfide.
Manager Lawson.
Through the chair to Councillor Clark, I believe on page 4, you'll note that total reduced sulfur, or TRS, was also assessed. Total reduced sulfur, it is believed, as the Ministry of the Environment, Conservation and Parks reported back in October through their report, and subsequently staff reported back to council via communication update of their findings. They estimated that the total reduced sulfur that was being assessed for was comprised of hydrogen sulfide, and this air sampling survey did test for total reduced sulfur and hydrogen sulfide. It was believed to be the component. Happy to report that of all of the overnight samples of hydrogen sulfide or total reduced sulfur that were assessed, there were no exceedances, and they were all below detectable limits.
Thank you for that. That helps me a great deal. It just wipes out a whole bunch of questions here as I'm going through this. One of the things that I found, I guess, intriguing in this report, on page 5 of 6, it is important to point out that on 4 occasions, including May 30th and May 31st, where Atkins Realis staff detected odors, I'm assuming they smelled the odors, measurements were below the reportable detection limit, which refers to the lowest value that air monitoring method use can report with confidence. Therefore, odor detection by individuals may take place even when reportable detection limits are not met. That was intriguing to me, because what residents were being told, well, it's not in the air sampling, but you're telling me in this report that the Atkins Realis staff actually smelled the odor, but it was not detected in the samples?
Through the chair to the counselor, that's correct.
Can someone, perhaps yourself or Mr. explain how that can happen?
Through the chair to the counselor, I can give you first an example of an inverse of that, where there was a 10-minute grab sample based on odor that did exceed the 10-minute odor detection value. But at the time when they were collecting that sample, there was no odor detected by the individual who was collecting the sample. So both scenarios are where odor is detected, but it's not found in the analysis can happen. As well, when you find something in the analysis, you're not detecting any odor. So all of this is explained by the varied nature, or could be explained, may be explained by physiological differences among individuals. Not everybody has the same ability of odor detection. That's why there is a distribution among a population of who is maybe more sensitive and who is less sensitive. Physiological factors, age, sex, social situations where there may be existing odors in the community all lend themselves to qualitative identification of an odor. So there is no answer that I can give you, counselor, that really nails down why this phenomenon happens. But that is what the findings were. Some odors were detected on days where there was nothing found in the analysis. And conversely, there was one sample where there was sulfur identified in the sample. But qualitatively, the technician who set the canister did not detect any odors.
I use the term intriguing, and I continue to find that intriguing and probably frustrating for residents. There was one sample, Chair, if I may continue, and I only have one other question after this. That was, I believe, south of the landfill, closer to the Penny Lanes properties, and it detected hydrogen sulfide, or the employee smelled it. Can someone speak to that item?
Through the chair to the counselor, I'm not exactly clear on the question, counselor. There were 4 episodes where odors were detected. On one of the days where it was happening, there was garbage collection actually happening in the neighborhood, which may have contributed to that phenomenon. But on the other 2, it was just a qualitative analysis where they detected odor. I will say, when the technician is setting the canisters were set for 16 hours, and they were usually set around 8 o'clock at night. So they would have been collected the following day at noon. None of those analyses of the samples came back with any detectable limit for hydrogen sulfide. The samples that did identify hydrogen sulfide collected in the analysis were all collected with 10-minute grab samples. So when they were also setting the canisters that would sit for 16 hours, they were also taking a sample from a canister for a 10-minute exposure period just to see quickly what's there at that time. I'm not sure if that answers the question.
It does in a way, but I was under the impression in the report that there was a sample taken that was south of the landfill.
I think through the chair to the counselor, yes, counselor, I think you may be referring to the sample where the 10-minute exposure value for odor was exceeded, but the technician did not detect any odor. That sample was upwind of the, interestingly, another phenomenon, it was upwind of the landfill at that point. So based upon wind direction collected at the time of those samples, the likely source of the exceedance was not likely the landfill and came from an unidentified source.
And so the wind at that time was with the prevailing winds blowing out of the southwest and not coming out of the north.
Correct.
Okay. The last question I have, if I may, and I appreciate the latitude. One of the closing paragraphs I'm going to read into the public record Clearly, the importance of recognizing odor concerns for residents living nearby industrial odor sources must be emphasized, along with the need for the facility to implement a landfill gas utilization system, proper daily covering of waste, and odor diluting agents to reduce odors impacting residents living close to the waste facility. So it is interesting to me, as I indicated earlier, that residents may be smelling the odor and it's not detectable. And really what it comes down to is that this landfill operator and the ministry have to get control of the site to control those odors. That's the gist of this report in its conclusion. Is that a fair statement, Chair?
Through the chair to the counselor, I would agree with your statement.
Okay. And can I ask, are we sharing, now that this report is public, A, can I place it on my webpage in my ward? And B, are we sharing it with the Ministry of Environment and GFL?
Through the chair to the counselor, the report has been vetted through Ministry of Environment, shared with them for their information. And by all means, once it becomes published online, it becomes public record. So you would be able to publish it on your website for the information for community residents in your ward.
Okay, so I'm giving notice to council that I will be doing that. I know it's a report to council, and I will be sharing it with the Community Liaison Committee for the landfill. Thank you, Chair, for the time this morning. Thank you to the staff and to this board for agreeing to support this independent third-party air monitoring. It was really important to the residents in that community.
Thank you. Next up is Councillor Wang, followed by Councillors Kretsch and then Beatty. Councillor Wang.
Thank you. Through you, Chair. I'm interested in what now after this report, because this report is definitive in terms of saying what was in the air. Clearly, just as Councillor Clark has just read into the record, that there should be actions from GFL. In my ward, in Ward 3, we already have several air monitoring stations that are permanent. I also understand from a previous council term, there were maybe 2 portable units that were shuttled around the city. I thought that was what my predecessor had spent dollars on a portable unit. I don't know if that's actually true or not, but what are we doing now about this? Because clearly odors, air particulates, pollution is a citywide problem. At this point, Hamilton Air Monitoring Network, is really only situated in and around the Ward 3 and some parts of Ward 4 area. What can we do next is what I'm asking. I'm not sure who to direct that question to, Chair, but.
Thank you. I'm going to recognize Director McDonald.
Thank you, Chair Wilson. Through you to Councillor Wang, thank you very much for the question. So you do raise HAMN. Certainly, Hamilton has one of the most extensive air monitoring networks in the province. In terms of specific to the GFL, Stoney Creek Regional Facility, which was the subject of this investigation and this report, as you are well aware, I believe, the ministry remains engaged with GFL and through its work with the Liaison Committee, which our staff also attend. There are existing ministry orders against the company that have required further independent air monitoring for that facility. We do have real-time air monitoring, not only through that exercise, but through the HAMN network. And that's something that will continue to inform not only our work in this area, but our collaboration and work with the Ministry of the Environment, Conservation and Parks as it concerns those issues that you've raised. I'll turn it over to Matt Lawson if he has anything further to add.
Thank you, Kevin McDonald. Through the chair to Councillor Huang, the only thing that I would add is that on the HAMN website, through the order of the Ministry of Environment related to this GFL odor issue, the Ministry of Environment, Conservation and Parks did issue an order last year in October to GFL. And it also, under that order, it ordered GFL to procure the services of a third party to perform air monitoring to the satisfaction and plan of the MECP, which has been approved. That third party vendor has been hired by GFL. The plan has been approved by the MECP, and they are actually monitoring air quality at the landfill right now. There are 3 monitors that have been established there, and they are all available to be viewed on the Ham and Air website.
Thank you for those 2 very fulsome answers. I am still struggling with the so what. I'm not sure if we have a real plan in place to keep industry accountable. I am not sure if we even have a plan in place on how do we continuously monitor and keep the health of our residents top of mind and at the forefront. I'm struggling with the so what of this report. Perhaps that's another conversation that I'll have with Councillor Clark offline and with the rest of my council colleagues about this, but there is no definitive action and there's no plan in place to help with the so what of this report. So that's what I'm struggling with right now, Chair. Thank you.
Thank you, Councillor Wang. Councillor Cretch.
Thanks very much for the report, and thanks for your questions, Councillor Clark. A couple things stood out to me that I don't quite understand. I'm looking at Appendix A and the results from the sampling. If I look at the number of different samplings done, the majority appear to have a number associated with them and don't fall between the lower limit of detectability. And so, for instance, one of those things in the very first column, and I think in May, shows a number of 105. Then there's a steady stream in the middle of the column that shows 13s and 7.8s and these kinds of things. Obviously, the spike there, if we were to look at this from a charting perspective, would be that number 105. Even though I know that these may not meet the lower detectable limit for the purposes of the sampling, right? What I'm seeing is the majority of those boxes are filled in, not the minority. Could you contextualize this a bit more, and could you identify perhaps what those different numbers mean with respect to the impacts residents are having, especially that number that's quite high?
Yes, through the chair to Councillor Cretch. Councillor, the table is not the most simple to read in the sense that it does show 13s all across. That is what the actual ambient air quality criteria value set is, that you don't want to exceed for a 10-minute exposure. And the 7.8 value on the bottom row is the adjusted 16-hour ambient air quality criteria that you wouldn't want to see exceeded. So what you're doing is a comparison on the second row, or sorry, the third row, where it says less than reportable detection limit. Everything was below that 7.8 value. The only elevated results that are shown here are on May 27th for 105 micrograms per cubic meter when it should have been 13. So that's a 10-minute grab sample, and that's a 10-minute value that is the 13 micrograms per cubic meter is a value that is based on odor. So the interesting phenomenon, again, being when the technician collected that sample, no odor was qualitatively defined or noted in the field notes, yet the sample came back with 105 in it. And again, that was the sample that was collected upwind of the landfill at the time. The other values that you can see of 7.9, when it's compared to the 13, you can see it's below the value, as well as the other value that shows on June 2nd to June 3rd of 5.8. That was another value that was detected, but it was below the threshold of 13 micrograms per cubic meter. So in terms of its impact on residents, it does demonstrate that there is detectable hydrogen sulfide levels if we're assuming that the TRS is composed of hydrogen sulfide. So it's validating the fact that it's there, it's in the air. But what it also demonstrates is out of a majority of samples that were collected in this survey, the overwhelming majority were not detectable in levels that were detectable, and certainly below the health standard. The ambient air quality criteria values for health-based thresholds, there were no exceedances of any health-based threshold identified in this survey.
Thanks very much. I ask these questions because, of course, I know you'll collect other data when you hear from people about what time of day and those kinds of things, and that's obviously mapped on top of this data. I think it's interesting that we're talking about two different kinds of things. We're talking about sampling data, and then we're talking about anecdotal experiences from people, including the technicians that are there doing this work and the experiences they're having. Meanwhile, there's obviously still a very strong odor permeating the area from time to time. I know that the testing you talked about, a lot of it was done, you said, overnight, and I remember when we had this conversation some months ago, Councillor Clark asked about the time of day that some of these sampling could take place. I know that, to be very basic about this, when it's hot out versus when it's not hot out can sometimes have an impact on some of these things, and including on the stress people feel day to day, right? So when they're going through their day, they may be feeling more stress in the hotter weather. That's a known thing. And then, of course, these smells and things may be triggering in those moments. Did you use that kind of analysis in terms of the kinds of long-standing, not the 10-minute, but the 8-hour, you said overnight? Did you do the daytime long-standing testing or sampling, or was that not part of this? And I just want to understand why.
Through the chair to the councillor, back in 2023 in the fall, it was noted that many complainants in the neighborhood who were reporting odor detection often detected it strongest in the very early morning hours, as well as the late evening hours. That's when they said it was detected at highest. When it does get hot out, to your point, like it may create a vapor pressure imbalance where odors might come out more readily. It might also help them disperse more. Where it gets cooler and a little bit less windy in those morning and late evening hours is when those chemicals may be more detectable in the neighborhood. And that's why we chose this, setting them at 8 p.m. and collecting them at noon. So I think that answers the question. Please let me know for more clarity.
Yeah, I think my only comment really on that is thanks for clarifying that. That's my assumption, and based on the report, that's what I understood to be happening. I think it might be helpful to put a bit of confirmation to test that bias, if there's other sampling done in the future, because running that in the opposite time that people are suggesting they're hearing this might be helpful in terms of confirming other kinds of results, right? I mean, I really appreciate that you're taking residents' experiences seriously and trying to test at times they're telling you it's happening, but testing outside the time they're telling you it's happening might also provide you with some insight if, for instance, those results were aberrant. I guess what I've learned from this is that there have been moments on this where certainly the sampling tells us, yes, there's an exceedance, yes, there's a smell, but what we're finding is that, frankly, it's hard to measure the moments when this is happening to residents, and it's hard for us to track down the anecdotal thing that's occurring, which makes it difficult for us to figure out exactly what the cause might be. Anyways, I appreciate your work, and thanks for answering my questions.
Thank you. Councillor Beattie.
Thank you, Chair, and through you. Thinking back to Thanksgiving Monday, 2023, it was a windy day. And I live 14 kilometers downwind from the facility in Winona, and I went out my front door and I could smell it. And I think that experience that I had has led me to have some extreme empathy for the residents surrounding the facility, which is why I think I may be following this almost as closely as the ward councillor. And I'm very appreciative of the report. It was a good read. There's a lot of data in here. My simple brain was able to process most of it. But I want to kind of build on Councillor Clark's questions with regards to the locations southwest. I think we indicated that they were upwind. And some of the sampling that was done there, and I'm looking at Appendix B on page 16 of 198. It's a little map there. Shows two monitoring locations in relative close proximity to each other, First Road and a little further down, closer to St. James School. It appears that these were the highest levels measured, and one was an exceedance of H2S. And I think what I heard from the bench was that during the sampling, we measured exceedances, but there was no necessary odor detection, which I think raises another question as to, are we smelling H2S or are we not smelling H2S? Can I just confirm that I heard that correctly, that when these exceedances or high levels were detected, there were no corresponding odor complaints at the same time? Is that something that somebody can answer?
Through the chair to Councillor Beatty, on the one exceedance for the odor value, the 105 micrograms per cubic meter sample, there was no field notes from the technician that indicated that there was odor detected. There was field notes, but no odors were detected that day on that exceedance. That's correct.
Okay. So it's possible that the scent and the H2S may be separate issues, that hydrogen sulfide may or may not be part of the stench, the odor. Is that a plausible scenario?
Through the chair to the councillor, that is plausible in the sense that everybody is not calibrated to have the same experience through their sense of odor detection, but we use laboratory equipment to try and quantify and get an actual value number to the reading. But it is hard to reconcile when you have an exceedance like that and somebody isn't smelling it. So it is an interesting phenomenon.
And I guess, and thank you for the answer, I appreciate that. And I guess I'm looking at the exceedance that was the further southwest, closer to St. James School. I'm sorry to highlight that. It's not my intention to highlight the school facility. It's just the proximity on the map, that's all. But then slightly to the east was an elevated level at the First Road site. Those two in proximity to each other, I'm curious if anybody would hazard to hypothesize or offer a guess, an educated guess, as to what might be happening in that particular area that would cause elevated or exceeded levels of H2S. Knowing that we're upwind from the facility, so the likelihood that its source is the facility is greatly lessened. Any guesses, Mr. Dixon, or from the bench?
Through the chair to Councillor Beatty, I will at this point hopefully call upon Darren Dixon from Atkins-Reales to potentially give some experiential information related to this question that Councillor Beatty has about what might explain the elevated TRS value when it's upwind of the landfill.
Yeah, so unfortunately, it wasn't within our scope to be looking for other potential sources. The scope of the project was related specifically to trying to detect if there was continuous and or ongoing periodic sources of odor that also created a health-related concern for the immediate residents. So as has been noted, for the exceedance and for the elevated concentration on First Road, I believe in both cases they were upwind at the time. We have a wind rose included in our document that shows the predominant wind direction, and we have the wind directions noted at the day. For the one exceedance, for the 10-minute sample, I believe the wind was actually blowing from the west. It wasn't a southwest, it was a due west wind at the time, and predominantly overnight. But we would really need to go out and trying to track down sources of odors. I mean, we know there's a likely odor source here and we had trouble detecting it. So trying to specifically attribute a single exceedance and then a second elevated value to its source would be a very time-consuming and likely expensive proposition. I'm not sure if that answers.
Yeah, actually it does. Thank you. Through the chair, I appreciate that. Expensive and time-consuming are not two of my favorite things, but maybe necessary, perhaps, if we end up going down the road of further testing. And I'm going to maybe just keep this one in the back pocket for now. And as we move forward on this, I'm curious, as I'm sure are others, as to these particular sample sites. And perhaps it may come up again in further testing. So thank you, Chair, for the indulgence.
Thank you. There are no further speakers. If I could ask Councillor Jackson, as the deputy mayor of this month, to take the chair for a minute.
Floor is yours, Councillor Wilson.
Thank you. I'm going to because the themes have been raised, just stretch this scope a bit, because we've had some folks reference what's next and highlight the importance of air quality to the health of residents and all that's involved. Just a not so fun fact, 2 points. In the late 1970s, the federal government actually did have a very short-lived Ministry of State of Urban Affairs. And at that time, in the 1970s, they initiated a survey of 23 urban centers across Canada, inquiring about public concerns. Every center listed inflation and employment as top concerns, with one exception: Hamilton. Hamilton was the only center that differed slightly. In Hamilton, in the 1970s, air pollution placed third. Hamiltonians were distinctly unhappy about the quality of this city's air. We can move from there to maybe 12 years ago, when this city's local newspaper, the Hamilton Spectator, did a very detailed series on cancer rates across Hamilton. And it concluded absolutely that we have a terrible cancer problem in this city that breaks down along class lines. The overall death rate from all types of cancer combined in Hamilton's inner city core is almost 90% higher than in Ancaster. The direct relationship between some of the things that we've talked about today, income, but certainly environment. So to my colleagues, those around this table who are advocating for no trucks in inner city neighborhoods, those of us who are advocating and questioning perhaps the continued exemption that is secured to enable a steel manufacturer to far exceed benzopyrene emissions as part of their operations. Those of us who question the legitimacy on a health basis and that it's actually our competitive advantage to have 5 lanes and then 10 lanes when you couple the 2 Main and King through our lower city neighborhoods. These collectively have consequences on the young brain development of children and ultimately the cancer rates collectively of the people who live there. 90% higher cancer rates. I appreciate that this conversation and the real concerns about it have enabled us to talk about our shared and our collective commitment to providing for better health outcomes of all residents. I'll assume the chair.
Cogent, salient remarks. Councillor Wilson, chair's back to you. Thank you.
Time, please.
Thank you, Chair, and I sincerely appreciate all of the comments that I've heard. This landfill does not fall within municipal jurisdiction. This municipality has very limited legal authority over the operation of this landfill. When there were odors, Nick Winters and his team from Hamilton Water were testing on an ongoing basis the leachate going into the water, into our sewer system, I mean. And they found on 3 occasions that there were exceedances and they issued notices of compliance. So they continue to monitor what the company is putting into our sewer system to ensure compliance. That is one of our legal authority. But this council, this public health board, has done a number of things when this first started. When it first started, Chair, I went to public meetings where people were angry, yelling and screaming, and they didn't understand that we had no control. But I was the only politician there. Subsequently, another public meeting I attended, as did the local MPP for Upper Stony Creek. And at that point, I think the ministry started to wake up. In the meantime, the mayor, Mayor Horvath, the city manager, and I were advocating to our appropriate contacts. The mayor was advocating to the Minister of Environment, Minister Piccini. The city manager was advocating to the deputy minister, again, her appropriate counterpart. And I was advocating to the local district office in the city of Hamilton. That push, in my opinion, caused the ministry to really take notice. After that, they started to do air monitoring, which was interesting because it hadn't been happening prior to that. This city also complained about the height of the landfill. And we argued that that is contributing to the odor. We were told, no, it was not. It's got nothing to do with the landfill, it's just the leachate. And then many months later, after we continued to advocate, the actual Ministry of Environment officer issued orders, and what did they say? It's not just the leachate, it's the landfill. And they ordered them to lower the height. I asked, and we advocated for the capping of the landfill in areas where the landfill was no longer receiving weight. In other words, if it's hit the final contours, grade it and cap it, because what that capping does is it prevents its clay, it prevents the water from seeping through, the percolation, and it lowers the production of leachate. The ministry finally ordered that. We were concerned about what the air monitoring was, because what we had heard from the residents is that ministry was only sampling the air in the daytime. That prompted us to move this motion here for our staff to do third-party air monitoring in the evening. Subsequent to all of that happening, the ministry then ordered the company to set up a third-party air monitoring 24 hours a day, and it's now in that I can't remember the name of it, Hammond, thank you, system. So the residents at any time of the day can look it up on their computer and see exactly what's happening in real time. What a remarkable improvement. So I hear my council colleagues say, well, what next? Well, we've been doing what's next for the last year and a half, because this city has been pushing the government to do things because it was an untenable situation. So we will continue to participate in the Community Liaison Committee. We will continue, and Councillor Jeff Beattie attends the community impact meetings with me. And we will continue to keep this council updated on what is happening. But it is fair to say that the ministry, another thing that we did, when the ministry ordered the lowering of the height of the landfill and they gave the company 2 years to do it, this council said, it should be as soon as possible, preferably within 12 months. Because 2 years of odor from that height of that landfill is, again, untenable. And so we have pushed the ministry and GFL to take it seriously and to address these issues. I can't speak to all of the other issues in the city that we are wrestling with, but I think what we have proven over the last year and a half, that this council, while it does not have legal authority, and with this mayor who does not have the legal authority, we do have bully pulpit authority. And we will use our voice to speak for those residents who are struggling through these situations. Because it is very tiring for them not to get a response from the Ministry of Environment. So I want to thank this council for continuing to support me on these initiatives. We are making headway, and we're doing what we can legally to help residents through a position that they should never have been put in. And one last thing, we also asked the minister to change the rules so that this municipality can veto any future expansion. Thank you, Chair.
Thank you. The item has been duly moved and seconded. If we can have a vote on it, please. Thank you. That carries 15 to nothing. We're on to consent items, 9.1, third-party air monitoring. Beg your pardon. Blah, 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 blah. Discussion items, 10.1. American Society of Heating, Refrigeration, and Air Conditioning Engineers Standard 241 and Indoor Air Quality. This is report BOH 24022. It's moved by Councillor Crutch and seconded by Councillor Wang to get it on the floor. Any discussions on this report, please? Councillor Alex Wilson.
Thank you. Really appreciate this and understanding that we're not looking to kind of go in alone and these things are best done at the provincial level. So it makes sense to me to encourage that there is a consideration of what can happen at the building code there. As we're in the process of developing voluntary standards in our planning department, just wondering if we have things like this that are regard to environmental health and safety in our building and our built environment. I don't believe this standard is included in the draft of the green building standards, for example. Certainly not something we're looking to require by any means, but we're in a conversation about incentivizing best practices right now with the building community. Just wondering what kind of that conversation is. Happy to receive this report today. Maybe that's a planning committee question there, but just because this was here and we're asking the province to investigate raising the standard, are we doing anything with voluntary compliance or encouraging the standard within our development community, understanding it's not a requirement today?
Thank you. Would Director Walker, would you care to comment on the coupling between this request and the incentives we're seeking to achieve on our green building standards?
Through the chair, Director Walker, Jordan Walker, Director for Communicable Disease Control. So this was not considered for the local incentives for local building. However, it is certainly something that, certainly within our infectious disease programs, for instance, it is something that we continue to advocate for and speak about when we, for instance, conduct infection control audits, when we're working with facilities through outbreak management. So it is something that our program does address through those methods, but it was not considered for the local building planning code.
Councillor Wilson.
Thank you. And I guess like a similar piece here is, I think just in that voluntary compliance period, the standard's not set. It could be a decade before the building code's ever opened by the province. We don't control that. It's hopefully not a decade. But what does that, I guess, like conversation across departments look like? So for example, if there was a community organization that was planning an event, they're going through SEAT, they say, hey, we're booking out this building, we have this question or this concern, can SEAT get it? I'm not like, we're not at a place where I'm mandating these things. So within the promotion, education, awareness, access to resources, getting people the best information they can to make the decisions with this as a voluntary standard or as a kind of a best practice. Has there been any consideration within our public health team as to what kind of building those bridges across departments might look like or where those connection points are?
Director Walker.
Through the chair to the councillor. So at present time, when, for instance, events are being held through SEAT, this is not currently one of the items that comes forward to our program for this, but happy to take away and look at where that might make, where the opportunities to incorporate that might make sense.
I would suggest respectfully that some formal direction be provided by this committee to ensure that we receive some sort of I trust the staff, but some professional assurance that input is being,
Yeah, I'm happy to keep this here now, maybe
Okay.
follow up offline, and if there's a motion later, or if that comes at planning committee or another place, like just, that's a pretty broad topic, and so rather than kind of an information report, happy to work with staff to scope that to something that's a little bit more,
manageable?
well, actionable as well, as
Actionable.
opposed to kind of here are all the opportunities, there are a couple that we could act on, so thank you.
Okay, thank you very much. Councillor Nan.
Thank you, and through you, Chair, appreciating the report, understanding the limitations of the recommendation, but had a question regarding another issue that I'm sure each office around the city has heard plenty of, particularly at the end of the school year, and how many of our school-aged children have struggled staying in classroom as a result of poor air quality. And it's not just around infectious disease control, it's also from the fact that those rooms are at a temperature that is causing heat exhaustion, heat fatigue, heat fever, rashes, et cetera. For our children, I know that multiple Ward 3 schools, sorry, my watch just started talking to me. Multiple Ward 3 schools had cohorts of the students not attend school because the rooms were too hot, as well as anecdotally, we heard from our school board trustee that there were several children who had to go into urgent care for those several weeks of heat wave at the end of the school year. So if I could, through you, just get comments from the staff in terms of the recommendation that's here. I see an emphasis around controlling infectious disease. Is the concern around indoor air quality also inclusive of temperature?
Dr. Liu?
So to the councillor through the chair. So this report has come about as a result of a particular engineering standard that was relatively new as published by the association. And so the background relates specifically to that particular standard, which is centered around infectious diseases.
Okay, thank you. I'll take the remainder of the conversation offline.
Thank you, Councillor. No further speakers on this item. I believe it was duly moved and seconded. Yes, thank you. It's up for your consideration. Please vote now. Thank you. That carries 15-0. On to 10.2, Staffing Fall 2024 Immunization Programming, Report Number BOH 24021. If I can have Councillor McMeekin, seconded by Councillor Pauls, to get this on the floor, please. Comments or questions on the report? Councillor Jackson.
Thank you. Good morning, Councillor Maureen Wilson. Just asking through you to the author of the report, Director Walker. So provincial funding will cover the first year and for the 10 new FTEs for the vaccination immunization program in the schools. What happens when the funding runs out, or do we annually have to apply to the ministry, or will it then be absorbed within our local levy? Through you, Chair Wilson, please.
Thank you. And if I may be so bold as to, could you set up the report for us as part of your response so that we can understand? Yeah,
Did you
fully.
want me to rewind my question and you could have gone in first, or no? Okay.
So thank you, Chair, and thank you for consideration of this report, which we've brought forward. So as we, very shortly approach another fall respiratory virus season, the Ministry of Health has reiterated their direction that public health units as the local leads for vaccine programming can continue to play a central role in the delivery of those fall respiratory virus campaigns, including both COVID-19 and the publicly funded respiratory syncytial virus, RSV, vaccine, which was introduced in Ontario just last fall. It's also our understanding that that program, while continuing this fall, is currently being expanded as well. These additional vaccine programming, however, creates pressures, obviously, on Public Health Services vaccine programming resources to deliver on these services. And in order to have staff in place to do the fall respiratory season programming, recruitment really would need to begin as soon as possible. To support the COVID-19 and publicly funded RSV vaccine programming, the province has communicated the availability of funding to support public health units in delivery of these services. We do expect this to be 100% funded, and it would be our intention to apply to the Ministry of Health for this funding to support the staffing costs that are recommended in this report. To ensure the availability of staff to meet that operational demand, as well as to support recruitment and retention of skilled public health staff in a competitive landscape, the report recommendation is to go what we call over complement in terms of the number of permanent positions that we're offering. This means that the employees hired would be offered a permanent spot, and then we would manage those within the funding made available through the Ministry of Health to support this work. This is an approach we've used previously, both during the COVID-19 pandemic as well as prior with our nursing workforce, to successfully attract skilled candidates to these positions and to support retention of those staff. So this recommended approach would support the staffing and flexibility required to meet what we anticipate are the needs for the respiratory vaccine programming and allow us to continue other critical vaccine programming without impacting those resources, such as our school-based vaccines and our work under the Immunization of School Pupils Act. So that's why this report is before us with the recommendations. Now, with respect to the funding, so this funding that we would be applying for, there was similar funding made available last year. However, the funding essentially was made available in time, to clarify this is to answer the councillor's question. When that funding was made available, it was done so sort of in conjunction with the launch of the program, which really didn't allow an opportunity to recruit staff and to have staff available to do that work, which is why the report before you is recommending that we would proceed sooner in advance of actually receiving that funding. Now, the funding that we understand is available in terms of what we've been told and what's been communicated so far is we can expect similar to what we had last year. Based on what we see in terms of where both the COVID-19 vaccination programs and the RSV vaccination programs are going, where we've had for a number of years now a fall campaign, a spring campaign for COVID-19. The RSV vaccination campaign was launched last year and is being expanded this year. We absolutely expect that this work, and with public health units playing a central role in it, will continue for the foreseeable future. So we expect that the workload demand would be there, and thus far the province has year after year been committing resources to providing that. So certainly we would continue the work for as long as it's there and ultimately look to fund those positions through ministry funding. However, if that funding were to end, as is true for any of our programs and services, all of our programs and services really have very specific funding stipulations. If that funding were to end, we would look to reduce those positions at that time, reduce those FTE positions at that time, and ultimately we would look to do that through attrition while managing our budget within existing resources through managing vacancies ultimately, because we do know that we have a fair amount of turnover within our workforce, and that would allow us to do that.
That was an amazing answer, Chair Wilson, from Director Walker. Really appreciated the entire context of it. And so to the essence of my question, it sounds like so far so good from the current administration at Queen's Park. And it sounds like we'll be hearing from you on an annual basis. If that sustainable annual operating funding will continue for the very important 10 FTEs. So obviously you'll keep this council at least annually, if not maybe semi-annually, Director Walker informed. And can I just ask then, this is simply about immunization on the respiratory side. This isn't adding enhancements on the measles, chickenpox, polio, any of those type of things that we support our schools and our children with as well. That's my last question through you, Chair Wilson, please.
Through the chair to the councillor, thank you for the question. This funding is, and these resources are specific, yes, to the respiratory viruses, so to our COVID-19 vaccination, influenza, and also to RSV. However, while these resources are not necessarily being used for that, the nature of the vaccine programming is, if we did not have these resources, we're essentially trying to prioritize within our vaccine program as to what we can do. So by having resources available for this purpose, it means that we're able to keep our other vaccine program services going without impact in terms of the areas you mentioned, our childhood vaccinations and our work under the Immunization of School Pupils Act. So having these resources allows us to continue without impacting those and needing to defer resources away from those to address the respiratory virus work.
Director Walker, we are in excellent hands with you and your team, and I'm fully supportive of this recommendation. Thank you, Chair Wilson.
Thank you. Councillor Taddison.
So I had a lot of questions when I first saw this report, and I saw, 10 FTE, and then I went through it and I read, and I understand that the goal is to create capacity in the public health department here in delivering vaccines, and this specifically to, support those in retirement homes and pregnancy and people with children under 5 who can't necessarily get to I guess what we call a drugstore where you can get free vaccinations and so forth. My question in going through the details here, I'm trying to understand the difference between what a vaccine inventory clerk, a data support control clerk, and a reportable disease data clerk. Do we need 3 people to do that, or is that something that can be combined into one? Or educate me, please.
Through the chair to the councillor. So those are currently different job descriptions that exist within public health structure. Each of them do different roles. So reportable disease data clerks ultimately are responsible for managing, for instance, incoming lab reports and managing of those through a provincial database. There's the inventory clerks are the ones that are responsible for managing our incoming inventory as well as outgoing inventory, because we as public health services are really the primary provider of publicly funded vaccines out to community providers, and we have a number of roles with respect to management of that inventory. And then the third one there, the data support control clerks, are individuals who are more often working in clinics or working closely in conjunction with our nurses to, for instance, collect records on who's been vaccinated and ensure that those are entered into appropriate public health services, or not public health services, sorry, appropriate provincial databases. So they are currently separate roles within the current existing within our existing structure and within the existing collective agreement. And so they are distinct roles. And so all 3 of those play important roles in supporting our vaccination programs.
Can I ask who's doing those jobs right now if we need to hire?
Through the chair to the councillor. So we do have individuals currently employed in those roles. The reason for the ask for additional is that with the addition of, for instance, the COVID-19 vaccine, which of course we had not been doing pre-pandemic, with the addition of the RSV vaccine, which again, not something we had been doing pre-pandemic, we have additional roles essentially there's an additional volume of work with respect to managing that inventory, managing those records, managing that incoming pieces in terms of those records and getting those databases input. Our staffing complement in each of those areas right now currently reflects what it was pre-pandemic. And so as long as there is a role for public health units to play that central role in supporting these respiratory virus season vaccination campaigns, we do anticipate that there will be additional work there, and that's why the additional resources would be needed.
As Councillor Jackson just said, would these, or just complimented, would these people help with the other vaccinations as well? And like I said, in that role, inventory, data support, and reportable disease data?
Through the chair to the councillor. So the funding for these positions is really specific to supporting the COVID-19 vaccination as well as the RSV vaccination. Now, that being said, the existing staff doing those are splitting their time between, for instance, our school-based vaccine program, et cetera. So by having these additional resources that are funded for RSV and COVID-19 and able to focus on that, it does mean more allotment of the existing complements time to spend on getting caught up on and doing the work that we need to do in terms of supporting childhood vaccinations and supporting our community to get caught up on childhood vaccines, which we know are still a concern post-pandemic due to barriers that existed during the pandemic to getting those vaccines.
Thank you, Director.
Next up, we have Councillor Clark, followed by Councillor Pauls. Councillor Clark, please.
Thank you very much, Chair, and I'm still a little bit confused, especially in light of Councillor Tattison's questions. So just help to clarify, did we hire additional FTEs during COVID 2021, 2022, 2023?
Through the chair to the councillor, yes, we did hire additional FTE. The vast majority of those individuals that were hired throughout the COVID-19 pandemic and funded through that COVID-19 extraordinary funding and COVID-19 vaccination program funding were temporary contract staff. And with the ending of that funding, which we had been informed that funding would end at the end of December of 2023, many of those contracts were ended because they were not permanent positions within our organization.
Thank you for that clarification. The vaccine inventory clerk, data support control clerk, and reportable disease data clerk. I thought I heard you, Chair, indicate that they're already filled.
Through the chair to the councillor, yes, we do have individuals in each of those roles. However, with the additional COVID-19 and RSV work, the amount of workload there exceeds the capacity of the existing complement.
And the supervisor?
Through the chair to the councillor. So the supervisor position would be required depending upon if we are able to hire all 9 of those positions, depending upon the scope of the team, just trying to keep really that span of control in line with the rest of our programming services.
Thank you. And do we have any reports that would indicate the amount of load that was lifted from our public health unit by the province approving pharmacies to hand out COVID vaccines, RSV vaccines, pneumonia vaccines, et cetera, et cetera?
Through the chair to the councillor. So pharmacy absolutely still plays a significant role, particularly with the COVID-19 vaccination and influenza vaccinations, wherein they're roughly, I don't have the report in front of me, but the expectation is that they're providing about 70% across the province of the primary throughput through that. However, public health services clinics and our role in this remains both on the inventory management side, where while pharmacies have their own inventory management and they receive stock directly from the province, not through us, all other community providers, all of that vaccine needs to move through us and we're responsible for managing that inventory. However, with respect to the actual vaccine administration, the role of public health units remains to work with community partners as well as to ensure ourselves access to equity deserving groups and really focusing on those individuals who would have barriers to accessing the vaccine through other channels such as pharmacy, because not all individuals could necessarily be seen at a pharmacy.
Thank you. And the last question is, so in the report, I was pleased to see, because we don't usually see this in a report, if the affiliated work and funding ends, in essence, the province gives us one-time funding all the time, and then they say, yeah, we're not giving you any more. But they've now induced the demand for the service that was being funded by them. We end up picking up that slack on the property taxpayer. What this report is indicating, should the province say, yep, nope, you got 1 year and we're done, or whatever the time frame is, that we would in essence, eliminate those positions, making it very clear the province cut the funding, and we would find work for those individuals within our public health unit through attrition. Am I reading that correctly?
Through the chair to the councillor, yes, that is correct.
Thank you. I appreciate that. Thank you, Chair.
Councillor Pauls.
Thank you, and through the chair, I know I will get some emails after this meeting. I just want to be clear that after the campaign that we're doing about the COVID-19 vaccine in our schools, that this vaccine is not mandatory. I want to be clear, it's not mandatory. Children do not need to have it if they choose not to, and that they can go to school. Can you talk about that and clarify that, please?
Through the chair to the councillor, you are correct. The COVID-19 vaccine is not a required vaccine. It has been recommended every respiratory virus season to help mitigate severe disease, particularly in those who are at highest risk of severe disease. But it is not a requirement, and it is not a requirement for individuals to attend school.
Thank you very much, because I think I had few emails the last time, and I had to assure them of that that is true. My next question was the last question that Councillor Clark asked, that if the government does not support, because it's going to cost over $1 million, whatever, I wrote it down, $1,200,000 and something. You said if the province does not support that after a year, what will happen to those 10 that we've hired? Because if they stay with the city, we still have to come up with the money. Is that correct?
Through the chair to the councillor. So this, and this would be true for any of our program funding, all of those positions are contingent upon the continuation of that funding. So if at some point ultimately that funding is no longer continued, then we would look to reduce those positions. We believe we can do that and have certainly done this successfully in the past, as referenced in the report, in terms of being able to manage that through attrition. So ultimately through management of our own internal vacancies and management within existing budget, through surplus within existing budget by management of our own vacancies, we believe we would be able to manage those positions through attrition. That is, ultimately find them other positions within existing base budget where, as individuals retire, as individuals leave the organization, we can find homes for those ultimately landing spots for those individuals.
Thank you for that, and that's good news to know that. I'm just wondering also, students that go to school, they don't have to get a vaccine at school, do they? Can they go to their own doctors? Can they go to a pharmacy? They could still do that.
Through the chair to the councillor, could I just ask for clarification as to what specifically which vaccines?
When we go to the schools, do we have a day like administer COVID-19 to all the students? Can they opt out and go to their own doctors?
So through the chair to the councillor. So we don't do COVID vaccine clinics directly in school. The clinics that we operate in schools are for the grade 7 vaccinations, which even those could be received at their family doctor, though it certainly makes sense to try and get it at one location when you can through the school program that we operate. But our COVID-19 vaccination clinics are really, they're mobile clinics that we operate throughout the community, again, to try to support access for equity deserving groups as well as those who have barriers to accessing through other channels. But yes, ultimately, children could receive vaccines through primary care, or if it's a vaccine that can be administered at a pharmacy, they can receive them there as well.
Okay, thank you.
Thank you. No further speakers. It's been duly moved and seconded, please, for your consideration. If you could vote now, thank you. And that carries 15-0. To my colleagues, are there any notices of motion? If I could ask Councillor Jackson to assume the chair for a moment.
Councillor Wilson, floor is yours.
Thank you. I haven't had time to give this the attention that I had hoped. Just to give folks a heads up, the next Board of Health, Public Health Committee, I will be serving a motion, and it has to do with the ongoing intersectionality of homelessness, mental health, and substance. And I think we need, and I need, some clarification on the parameters of jurisdiction here and the authorities of municipalities in responding to this crisis. So I will be asking for a profile of the mental health institutions that are active in Hamilton, a historic background of deinstitutionalization, and the Mental Health Act of Ontario and the roles, responsibilities, and limitations that municipalities and even police services can enact, because I think there may be some thinking out there that we can forcibly do things that we cannot do in responding to this crisis. So I just thought it might be helpful not to burden our staff too much, but to provide that kind of a profile. And we can use that in our discussions with constituents and our ability to communicate about this crisis. So thank you, Councillor Jackson.
So Councillor Wilson, to be clear, just an advance preview today, something more official to come later on.
That's my notice. And
Oh, is that an official notice for today? So the clerks captured that then?
they have it. And so it will be served as a motion at the next meeting. Thank you.
Perfect. Floor is back to you. Thank you.
Thank you. Thank you. We're on to general information, 13.1.
Sorry, Councillor Wilson, I believe we had another speaker. And
Oh,
Councillor
I'm so
Nan.
sorry. I beg your pardon. Councillor Nan.
Thank you, through you, Chair. Also serving as a verbal notice that I'm working with staff on a motion to address the concern around heat exhaustion and other heat-related illnesses in our school population, and requesting that public health work with our respective school boards to get a picture of where things are at in terms of status in our city as it relates to our schools' capacity to provide adequate HVAC and air conditioning as a public health issue. Thank you.
Thank you, Councillor Nan. Any further notices today? Seeing none. Okay, thank you. On to 13.1. A mover and a seconder to approve the amendments to the outstanding business list, moved by Councillor Crutch and seconded by Councillor Clark. The vote is up. Thank you. That carries 15-0. We're on to adjournment. It's moved by Councillor Danko, seconded by Councillor Beattie, that we be adjourned today. Thank you very much to staff who assisted in the preparation and the resourcing of this meeting and all the materials, along with the clerks. And I will see my colleagues this afternoon at Public Health, or Public Works. Councillor Pauls, thumbs up? Yes. We are adjourned. Thank you.